Sure. Hi, Clay. This is Steve Goodman. So you said a lot of really, really interesting stuff there, and cited some good examples of stuff that we've just been wondering about. Um, I wanted to go back to a few of them. First of all, could you say just a little bit more about this platform that was established? What was its name, and was it just really a place to just post things? Was there any standard format? Could you go into a little bit more detail? And then I have another question or two, and also the cost associated both with setting it up and of maintenance.
Yeah, sure, Steve. So the platform is called UCSF DataShare, and you all can go and check it out. If you just Google UCSF DataShare, you'll come to it. And it was adapted from another platform, one used for the social sciences, and I'm blanking on the name of it. It's been more successful in the social sciences.
Dataverse, Ida says.
Wait, say it again.
Dataverse.
Dataverse.
Dataverse, that's right. Yeah, it's adapted from the Dataverse platform. And it cost us about, it was probably about $75,000 to set it up. And we got a lot of support from the California Digital Library to make it work. It did not work out of the box at all. And you should go on and just sort of check it out. It's got a lot more functionality than it needs for 12 data sets, that's for sure. But it certainly could tolerate a lot more. And that was the notion that it's not as though this is a done experiment. It's just begun. So it hopefully could gain steam. But we quickly realized that the incentives were not set up adequately to make this happen. And I can talk more about other things that we considered and abandoned, if you'd like, in terms of supporting stronger incentives to use it.
Well, I think we'll look at the information online. But with regard to the data sets that were, I guess, downloaded and other publications produced, I had a few questions. First of all, to what extent did the other publications come to any either slightly or materially different conclusions? Second, did they make it clear that it was really just a downloaded data set? And maybe most importantly, was there any way to track back to the original data? I mean, if you read these other publications, you knew about it, but how would one find out if from the same data set there were multiple publications? Is there any easy way to search either the literature or the original library where they linked back? Did they have to say what publications derived from it?
Yeah, so those are great questions. So anybody who used that data set would refer to ADNI, and that was helping them to get it published, actually, to say, wow, I'm publishing from this data set. I would say, though, except for editors or people who are more deeply involved, and obviously you try to find reviewers that understood ADNI and who was in and who was not. But if you didn't find them, I think it would be hard for people reading those papers to recognize whether an ADNI investigator was actually included in a publication, because there were many ADNI investigators, and they were all over the world. So unless you included, Mike Weiner, a couple other sort of core people, most people wouldn't know whether those were investigators or not. So, we enforced that at our journal and said, no, you were not an ADNI investigator, and that raised concerns about the quality. And we actually mostly rejected ones that didn't include an ADNI investigator because concerns about that. But I'm sure other journals weren't. There was a real rush to publish those papers and to get them out first, and so that definitely wasn't going to happen at other journals.
But that's all inside baseball and inside knowledge. If people from the outside, is there any way for them to know that these 4 manuscripts all came from the same data set, either going forward from the data set forward or from the manuscripts backward?
Yes, you could tell they came from the same data set. You could not tell whether an for the public whether an inside investigator helped.
Okay, thank you.
And then you asked at the beginning of that, though, you asked a different question too. I'm blanking on what it was. Do you remember, Steve?
I don't, but I'm sure several might. If it's worth asking, it will get asked again.
Okay.
First, I want to ask Dr. Sharman if she wants to comment on the last question.
I would agree with Clay. There's a lot of issues that will come up with the secondary analysis and who to look to and how will you resolve those disputes once they come about. A lot of responsibility will end up falling on the shoulders of the journals and the editors and the reviewers of who publish these manuscripts. But then ultimately it will come out to probably some of the data reviews, the Cochrane databases, that when they now will go back and look at some of these studies, how will they resolve some of these issues if there's differences in the outcomes of the studies?
Yeah, that actually was my first question. Were there any material differences in these republished analyses?
Yes, there were actually. So there were some that identified risk factors that others said were not risk factors, for example, for going on to develop Alzheimer's disease. And the differences between those would be, things like what variables were included in the multivariable model. And, you know better than I how gameable that is. So yes, there were some examples like that.
Thank you. We have a number of questions from Ida Sim, Scott Halpern, and Tim Coetzee.
Okay. I have a quick question for Clay and then one for both of you. Clay, would you know the ADNI experiment has gone quite far, I think. Is there any feedback that we might get on how the investigators feel now about having the data come out so early, as you say, with sort of, lots of papers being published or submitted? Is that something that the investigators in that field feel is a good experiment, or should there be more, perhaps slower release or a different release model?
Yeah, that's a great question. I would say the person I've talked to the most about it is Mike Weiner, and he feels like it was such a resounding success that it should be the standard. So he very firmly believes that what they did was absolutely the right thing to do. And so his take on it is, well, this is what happens. You get papers that show something, and others that show something slightly different. That getting it out there and getting it out there so quickly is better for science than slowing it down, and even if you have a chance of maybe getting it more right. I gotta say he may be right. I don't know. That's a sort of an ecosystem question. From the ecosystem perspective, it may be right. I don't think that would be right, actually, if the public was drawing conclusions from that data in changing lifestyle and all that. I think we lose a lot of trust if we've got junky stuff undermining the good stuff in the public's eye. But that was not the case for ADNI.
So my other question is perhaps a broader one, which goes to something that Paula brought up. I like the framing of this as part of team science. I think that is where we're moving to, but being in a CTSA institution, training fellows now, we don't really do a very good job of that right now. This seems to add a whole level of complexity that data sharing, as you say, should be built in sort of from the get-go rather than added on as an afterthought. Could you both speak to the resources within academia to both train our investigators in what's necessary and to provide the infrastructure that would be needed to effectively do data sharing?
Well, I guess I'll go first. One of the CTSAs in the University of Texas system, UT Medical Branch in Galveston, in conjunction with the one in Houston that's part of University of Texas Health Science Center Houston, as well as MD Anderson, actually are focusing on the science of team science and how do we not only understand, reward people for doing team science, but how do we train them? And how do we understand how to make teams more effective? And I think with, especially with this open data sharing, this even takes on even more levels of complexity, because now we're talking about teams that maybe got together to do a clinical trial, and now we're opening that data up to allow other teams to access it. How do the teams that are now accessing the data work with the original team or not? And do we want them to always work with the other team? Because once again, the outcomes could, you have the inside baseball of how the trial was accomplished, and that's very valuable. But then you also have teams where they don't have to look at the outcomes or try to replicate them because nobody on the team interacted with the original trial investigators. The complexities of data, the way that you can, as Clay said, game the system, and it's absolutely true, to determine which markers you look at are always up for interpretation, and the quality of the data. So I think there's a lot of the ways we're looking at how we're training trainees now and what their career options are, and it's a very fast-paced moving environment right now, because most of the people we train probably will not end up in academics. And how do we train them in the appropriate models? I mean, it's easy to buy certain software and do your own analyses, but how do we then incorporate statisticians and trial design to make it useful? So this is a very difficult question. I think the CTSAs have had a very important role, because we have training programs that, in general, if we can replicate them across different CTSAs and we share them, that will be one part of it, with the idea that some centers might specialize in one aspect and then create training modules that could be shared across not only the CTSAs but other academic institutions. I know that industry is also looking at some of these standards to say, how should you interact with us, and how to train people in better ways of doing it. So I think that the idea of this collectiveness of the CTSAs and training environments, which actually a very big part of the CTSAs are training, will help to create these structures that we need.
Scott, and then Tim, and then Jeff. Oh, Clay, go ahead. Sorry.
Well, I was just going to say that I think data sharing ought to be enabling for team science, but I'm not sure it will be. It lowers the cost of accessing the data and lowers the cost of then analyzing and publishing on a data set. And so that, to me, turns it, what might necessarily need to be a team sport into something that individuals could do. So my guess is you get more individuals from different disciplines accessing the data, which might be a good thing, but the utility of creating a team to access the data is lower. There's no reason to do that to increase the likelihood of getting a grant, or to, the data are the data, so it's not going to change anything about the quality of the data. So I don't know how the two relate. That being said, the second part of your question was, how do we train people to start thinking this way? So I think that whole transparency in science has to be taught from the beginning. So it's transparency, and it's also public good. It's you are doing this to help the public, and making that data transparent so people really can trust what you did, but also allowing others access so that it can have as great an impact as possible. That needs to be taught from the very beginning. Most of those lessons, though, are coming through mentorship. So it is going to take some time for us to change that part of the culture.
So one of the concerns that we've heard is that the risk-reward ratio of doing this may be particularly unfavorable for more junior investigators. where they need to think about spending their time, for example, submitting new grants, conducting new trials versus maintaining and sharing the data that they've already produced. The most obvious solution to this, of course, has been to just change how committees on appointments and promotions work. So the questions are whether that's feasible. Are there any models that we could point to where that's been done successfully? And then secondly, what ought we recommend if that is to be done in terms of how those, should we be talking about new metrics that these committees would entertain, or discounts, for example, for a secondary use versus a primary publication? Or are there, other ways entirely to think about this?
Well, I
Want to
think
start?
you want to go, Clay?
I
Yeah.
think I mean, if I'm a junior investigator, I just, published the primary paper, I probably do have some ideas for secondary analyses I'd like to get out. And if somebody does that, and it's not me, then that is that's a loss. So that's one. The other is, if I spend personally all this time to clean up the data and annotate it to get it out, that is a big investment. And I agree that currently I would not be rewarded for that as a junior investigator. So, our thought was that, for the junior investigator, maybe they're the senior author on that, and that whoever the data person is becomes the first author. And there aren't very many opportunities for the data people to be first authors. So it actually could be nice in terms of rewarding another key role. The other is, once it's published, then it'll be referenced, and if it's a highly cited publication, then I think that's great. And then lastly, if we can encourage the people who use that data to actually incorporate the expertise of that junior investigator who actually produced the data, then that person is actually then creating a larger research team, in effect, and getting more publications now as a senior author. So I think there are ways we can do it even within our current scheme of reward, but all those things will take some work and controls.
I think it has a lot to do with time management as well. I think we all have data that we always think we'll get back to, and then life happens and we don't. So this might actually force the issue a little bit more, make junior investigators plan a little bit more proactively about how they're going to spend their time. It may also help in mentoring them to say, well, this data could go out and you won't be getting that secondary analysis. But for the most part, investigators are busy looking at their own data. So it's not probably as big of a risk as we make of it, only because there maybe are small groups of people that certainly are interested in certain diseases who may very well swoop in on that data, but probably most of us aren't looking at our computer just waiting to download the file as soon as it happens.
Could I take prerogative and step in here to follow up on this question? Clay, I'm going to put you on the spot, if I may. You're the new dean at a medical school. Are you going to propose tweaking the promotions and tenure criteria so that, I mean, last time I sat on one of these P&T committees, we counted the number of first author, last author publications. Have you got your R01? All those sorts. Have you mentored, a trainee? But there wasn't any slot for, have you shared your data in a way that led to an important publication? Would it be helpful to sort of make that one of the criteria, along with teaching and public service and stuff that we're supposed to be responsible for?
Yeah, so we actually proposed that, Bernie, for UCSF. That was one of the things that we thought might help to really push this forward. And what we got back was an announcement to the campus that UCSF believes that people should share their data. And basically, there were no controls. There's no control over those promotion committees anyway. So even if we were to have been able to convince them to rewrite that part, it's unlikely that the committees would have changed their behavior. Most of them have been on these committees for years and and have their idea about what it means to be an associate professor, So yes, I actually do. So now, being able to start from scratch, you get to, you don't have to, there's not so much inertia. So you get to rethink these things. So I hope actually that ultimately we'll have a system in which we can use the same sorts of ways we think about publications and citations and impact to apply to data sets as well. So that a data set is a citable entity and it has a certain prominence, and based on the prominence of that data set maybe gets published in a more respected journal, data journal. Until we're there, then I agree we ought to consider the sharing and the impact of sharing on the world. So yes, but as we write our promotion criteria, whether we explicitly discuss this as an element or not, or just say, promotion should be based on impact, and impact is defined in these areas, I'm not sure yet.
Yeah, I'm cutting off one of my colleagues, but I had a question exactly on that point. It really is just a follow-on to either Clay or Paula, which is that is the problem that even given the information, the promotion committee won't consider it, or is that there isn't a good tradition about how to make it visible? Which I remember being very impressed over a decade ago when I saw a very sophisticated presentation on how to present a teaching portfolio in a way that people couldn't ignore it, that really showed the scholarship that was required to develop the curriculum and present it in a way other than a one line on a CV that said, I teach this course, I developed this course. And they said, if you're going to be promotable partly on your teaching, you must include this teaching portfolio. And there was a structure. I wonder if you could do the same thing here, even without including any of the formal criteria, that you actually present the documented information related to what you did and what became of that data in a way that the promotions committee, in a sense, couldn't ignore it. I've been on a number of promotions committee, and they actually try fairly to consider everything that's presented. But the problem is that most of the stuff is simply not presented. So my question is really, do you think that if it's there, it will be ignored, or that part of the challenge is simply to change the culture and knowledge of young and older investigators so that it's there, so that they don't include it just as a footnote or that it's invisible?
I think that's a great point, and I think we're coming up with different ways of being able to track data like SciVal and looking at networks, because obviously as clinical trials and as research becomes more distributed, having the contacts to be able to create the networks is going to be important. There is a function on SciVal where you can look at your contacts and you can look at them within the institution and you can look at them more broadly. Within the CTSAs and trying to understand metrics for showing what we're doing, let alone individuals on an individual basis, we're looking at how do we utilize this type of maybe more social media. I envision a day where sometimes on promotion and tenure committees, the number of tweets about your scientific article may very well be a promotable criteria. Now that obviously will mean we probably have to have a new generation of people sitting on the P&T committees. But I agree that we probably don't sell ourselves well when we're not the traditional academician trying to go forward for promotion and tenure. And that will become, I think, more and more obvious. I mean, even look at CVs as we're evolving. They talk about the number of references that have been made. And then, of course, your citations aren't all created equally. And so there are ways of drilling down on that data that I think as technology evolves will become easier to do and probably more acceptable to the next generation of people sitting on P&T committees.
Yeah, I think visibility is a great idea and currently isn't, this stuff isn't visible at all. I mean, I haven't seen a CV that says, here's my, has a data sharing section or impact of data or anything like that. So for those promotion committees that are already thinking about, national and international impact as their primary criteria and have loosened up their thinking about how they define that, I think that could be valuable. I think that as much as we can make it look like something that promotions committees already think about and put it into sections that are already included in CVs, the easier it'll be to help to change the culture. So that was where I was going with if we had data journals and those become public publications and are citable, that becomes then accessible as in the traditional format.
This has been great. My 16-year-old has a future, I hope. No, all kidding aside. I'd like to shift sort of take a different tack from the standpoint of academic medical centers. One of the areas that we probably need to contemplate are the financial incentives around this activity. And as deans, obviously, I think you have a lens in terms of the infrastructure costs associated with mandating this activity. And so some of the feedback we've received is that this could become a significant unfunded mandate. And so I think I'd be interested in both of your perspectives from the lens of managing research organizations. What would be a disincentive to really signing on for what seems to be everyone's agreement that we should do this, but this doesn't come without cost. And so from your lenses, what would you see as costs that need to be considered in establishing an infrastructure to support this? This is for both.
Well, Clay, as the new dean for the UT Austin campus, will certainly have a lot of input into what happens there because he gets to create it from the ground up. Being in more established structures, there's turf battles, there's all sorts of things. But even then, aside from the turf battles, it's the actual dollars to do it. And if anything, the research mission globally or within the United States is becoming even more difficult to fund, with NIH grants being awarded and then cut further, and then yet adding another aspect of, yes, and by the way, we want you to share the data, and we want you to maintain the data, and we want you to be responsive to everyone who asks you a question about your data. And that gets to a point where really it is just probably another burden onto investigators that are already spending estimates of about 60 to 70% of their time on the regulatory aspects of doing research rather than focusing on the research itself. And I can also say from an administrative vice dean role, we really don't have the funds in our budget to create this wonderful data structure and to maintain it. So I think there are going to have to be some more centralized repositories. I think NIH and other funders of clinical trials will have to add that as a component of the funding. I think that to really do it in a high quality way, that it'll have to be essentially mostly completed by the time the trial ends, a certain period thereafter. Investigators move, trials close, and people move on to other things in their life. So if we're really going to do this and do this in a manner that is trackable and also more reliable, it will have to be after the data has been analyzed by the primary investigative team and then put out in a fashion shortly thereafter.
Yeah, I am worried about the cost. I mean, the platforms, probably either the government or publishers ought to produce the platforms. They should not be local. I think the DataShare platform that we created at UCSF, it would be silly if every institution created their own platform. That's just unbelievably inefficient, and it just doesn't make sense. It doesn't increase the likelihood that the data will be reused. I mean, you're not going to go to all the search the web, but go to different sites to find a data set. It all should be searchable in PubMed, actually, along with a regular reference. So I think that this feels most like publishing an article. It's more work, and the data are more complex, and the data set larger. But it's like publishing a big article. And I think just as the publishing industry has been designed to help to balance and maybe hasn't done it in the way we'd like, the relative costs of those activities, I think we need to look at examples in the publishing industry, think about models that could be sustained, not at an institutional level, but at a national, international level. So I think, what does that look like? There should be a publisher, and that publisher is going to need somebody to underwrite its costs. And one could imagine an open access and non-open access, examples being supported on such a publishing platform. So let's say it's an NIH study. Maybe then the costs are borne by NIH, and that data is available to anybody who wants to use it. Maybe if it's not, or even if it is NIH, maybe there's a fee that's collected by people who are using the data. Having some barrier to entry for use, I don't think is a bad thing, frankly. And then maybe some of those costs are shared with the group that's going through all the labor to publish the data. And that incentivizes them to make the data easier to use and to actually work with people who are accessing the data. In that regard, it's a little more like the way reagents are shared today, where the costs, you can charge people, okay, I'm going to send you these mice, this is what you need to pay me, and then I'll help you to understand what's going on, and maybe we'll collaborate. So some model like that needs to be built. In order for that to even happen, we have to have policies that encourage people to then use that once the model is created. So I think it's the first step is to create the policies that encourage sharing.
Jeff Drazen, last question. We have about 5 more minutes.
So we're tasked, and one of the things is to look at risks and benefits. We've heard about potential benefits. You publish your data set, it's widely cited, it helps your promotion. To what extent do you think it's a risk that you publish your data set, people tear it apart, it's not all that reproducible, or it is actually, your findings are exactly right, but there are a couple of vociferous people out there. You're just say it's research about abortion, hot topic. Somebody's trying to get promoted. It's all out there in the public domain. Do you think that there's a fear on the part of investigators that if they put their data out there, it'll be used against them? And that it's not laziness, it's just that, what good is it going to do me? I can see a little potential good. I can see a lot of bad. And I know from my experience on P&T committees, it's just like a grant. If it doesn't go through easily, any roadblock is a really bad sign. So here's an opportunity to create roadblocks. So why would people want to do it?
I think there are always risks. And I think that science has really been lately under fire because of the non-reproducibility of animal studies, as well as the small clinical trials that were underpowered and came up with sweeping conclusions. The competition to get in the best journals and to overstate your data so that you have a stunning conclusion at the end of the paper to get into Nature or Science. Those are all real pressures, and the last thing that an investigator wants to do is have their data then put under the lens and found to be false, or at least not everything that the science article said it was. But I think that as a learning community and responsibilities that are beyond individual careers. We have a responsibility to the public trust that we do have to look at these studies, especially if they're landmark studies, and make sure that the analyses are correct. And just like anything else, there are always a multiplicity of opinions, and many of them can be valid even if differing at the same time. So I know that investigators are worried about this. They're worried about a lot of things, and this is just one more thing to add.
So I want to follow up on that. So here I am, I'm getting ready to put in my promotion package. And there's now a box to check by each article. Have you made your data set public? Yes or no? And if I check no, is that going to count against my promotion?
That's a tough question. And I mean, the P&T committees aren't really even evaluating, for the most part, data sharing in the first place. But I think that that could be maybe an evolution. Just like we're talking about journal articles that are now static PDFs rather than being able to click on something and see an interactive model, or be able to maybe access the protocol data sheet to say, okay, this is what gathered the data. I think that we will eventually evolve within our P&T committees so that it won't be a static piece of paper that they're looking at or a static PDF, but something that will have interactions and links that we'll be able to use for evaluating the candidates. I think that as academics becomes more complex, it'll be just like they say about medical schools. If you've seen one medical school, you've seen one medical school. If you've seen one promotion, you've seen one promotion.
Yeah, Jeff, I mean, I totally agree that this will be a disincentive for some investigators to put their data sets out. But I guess I don't care. I mean, I do. I feel for them, and you got to think about that as a barrier to sharing. But in reality, if their data set can't hold up to scrutiny, even by a group that's adamantly against whatever conclusion there was in the article, then that's worrisome, and they ought to be prepared for that. So adding that layer of transparency, I mean, it's just the same thing that you guys do. You know, you want to see more. You want to make sure it's right. Holding everybody to that standard, I think, is fine, even if in some instances it will be abused. Ultimately for society, it's going to be the right thing. But you're right, there's still the individual's disincentive to share, and that will need to be dealt with. And one way to deal with that, obviously, would be to say, okay, well, we're not going to even publish your paper unless the data set is published. But hopefully there are other ways, too, that we can encourage its publication.
So I just want to make sure I've gotten it right, so that you all see there is a potential risk for investigators here, but you don't think it's a showstopper in any way.
That's right. I don't. I think it's a risk that we ought to accept when we do a study. And we limit that risk by designing the study as best, as well as we can, and by analyzing the study as responsibly as we can, and by being as open about the strengths and weaknesses of the data.
It's not a showstopper, with the caveat, though, that it can't just be, there has to be support to the investigator to be able to do it. It's one thing, and this gets back to the comment about the unfunded mandate. It's one thing to say we should all share our data and we should all, love each other, but there are real barriers to getting that data out in a way that is meaningful and useful. And so we really don't want to punish investigators for having good intentions but not being able to deliver on sharing their data because of the barriers that we erect.
Okay, I want to thank our panelists, and actually all the panelists this morning, for a very stimulating discussion. We now can reward ourselves with lunch, which I take is right outside, and we can bring it back here and talk informally. And then I want to restart in exactly an hour by IOM time, so it's 59 minutes from now. And enjoy your break. Thanks.